Yes, I'm hereby giving you permission to record me to go over this thing. So when I look at the skull, first of all, I'm thinking, okay, what possibly is everything we need to know, and then what could somebody ask me on this? And so when I look at it, I see bones, I see holes, I see odd structures, and I see fissures. See, cameras in my face, they'll start messing up already. And so I start seeing, these cracks here. And so we see this is the coronal suture, this is the sagittal, and then remember body planes. This is the sagittal plane, that's the coronal plane, right? Up here is the upside down Greek letter lambda, and so we have the lambdoid suture. You guys see that? If you look at the side, we see that there's this crack here on the side of the skull, and so that's dividing the temporal from the parietal bone, and that's the squamous suture, okay? And so we see a couple sutures, again, the coronal, the sagittal, the lambdoid, and the squamous. So I think probably they're going to ask me one of the sutures, and so there they are. And then obviously let's just start talking about the names of the bones of the skull. And so we got this great big one here in the front, which is frontal, right? And then behind it on each side we've got the parietal bones. And so dividing the frontal and the parietal is of course the coronal suture. Dividing the two parietal bones here is the sagittal suture. And then in the very back, we've got the occipital bone, which is divided here because of the lambdoid suture. So the occipital bone actually comes way down, and you can see it circling all the way underneath here. So that's a big chunk of bone. You'd think it's just a little piece in the back, but it's the whole bottom of the skull, right? So when you look at it from the side view, we've got the temporal bone, and then you'll see a little line here. I'm going to use the stick so you can see. You see this little crack here, and it kind of comes up like that. And so this little bone is called and I want to show it to you from the inside, but the sphenoid. So when you look at it from, why is this so stuck? When you look at it from the outside, it doesn't look like much. And actually on my YouTube video, I accidentally said ethmoid, but that's the sphenoid. But the sphenoid on the side looks like a little bone. But when you look at it from the inside, and I don't know how you guys can see with your camera angles, but this entire middle section is sphenoid. It's the whole middle of the bone. It's holding everything together. So this is an enormous bone. It's forming the lesser wing and the greater wing inside here, and it's actually quite huge. You're just happen to see it from a side view. So let's look now, we talked about a lot of these bones here. Let's look a little more forward. You can see this is the cheekbone. So like these high cheekbones here are a bone called the zygomatic bone, and they form also the lateral orbit of the eye. And in the front here you've got the maxillary bone. And so this maxillary bone kind of comes up and forms the medial aspect here of the orbit of the eye. It kind of goes around the nose, but it has on top of here another little bone. You can see between my fingers is the nasal bone. So you think nasal, you'd think all this, but it's not. It's just this little piece on top. So the nasal bone's just a little piece on top, not even that big, and it's not part of the orbit of the eye. It's actually more medial, you can see there. So we got the maxilla comes down, holds our teeth here and the alveolar margins and processes. And on the bottom, of course, we've got the mandible. So the mandible is a whole different animal. So definitely from that, all I did is just name the bones, right? And so now let's look at the individual bones and possibly some markings on each bone. And just because I am on the top here, I'll put this back on top and I'll name some things that are on here. And really on the top, not much of anything. We got the frontal bone, right? But if you follow the frontal bone down, we could see it forms the top of the orbit of the eye. It's the roof, but you'll see a little hole here and a little hole here. And because it's above the orbit of the eye, we call that the supraorbital foramen. Now that actually would go in, if you were to drill, you'd end up in the frontal sinus. Does that make sense? You guys come on around if you want to see this. Come on over. Your view is not amazing there, but if you want to, you're more than welcome. If not, don't. Underneath here, under the orbit of the eye, and so we're moving down to the maxillary bone here, we see two other holes, and that's under the orbit of the eye, so we have the infraorbital foramen. And again, if we were going to drill right into that, you'd be in the maxillary sinus. So there are some sinuses which are openings in the skull. They make the skull lighter, they provide resonance of voice, and they make you humble because around the Midwest they give you a sinus infection and a lot of allergies. So the maxillary sinuses are in there. Again, if you follow the maxilla down, we've got the alveolar margin of processes, which is holding the teeth in right there. When we look at this, you're also looking at there's a nose here, so we might as well talk about it. So if you see this line in the middle, I don't know if you can see that from where you're sitting, but you have to kind of draw a line in the back of it. So you can see at the bottom goes back and the top goes back. So right about in the posterior aspect, if you imagine right around that spot, below that's a bone called the vomer. Now the vomer, you can see, I just made a mess, but the vomer, if you flip it over, you could see this bone here, and that's the posterior aspect of the vomer. And the vomer is basically dividing the right and left sides on the inferior aspect of the nasal canal. And then the top part is a thing called the perpendicular plate. Now that perpendicular plate is actually the bottom of this bone here called the ethmoid bone. Now the ethmoid bone is kind of like a wedge right here in the middle, and it's kind of small, and it's like it's wedged in. But the very top of that we'll talk about, might as well talk about now, called the crista galla. And the crista galla is like a divider, and there's a little groove on each side. You guys see that little groove? So what I say about that groove is I imagine taking a little baby nerve called the olfactory nerve, and I'm laying it in its crib. And so that's called the cribriform plate. So baby in the crib, that there, baby would be the olfactory nerve, and those of you who may not know, that's the nerve that helps you smell. So if you're wondering why there's little holes in the bottom of the olfactory plate, those are called the olfactory foramina. And so when we put that nerve in there, it's got little extensions that are going through these cracks, and they come out in the top of the nasal canal so that we smell. So basically, odoriferous molecules come in the nose, those little ends of the nerves get picking that information up, and it goes to the olfactory nerve, through again the olfactory foramina, lying in the cribriform plate, and therefore we smell. And again, dividing it, crista galla. That is again the ethmoid bone, the inferior aspect of that being this, called the perpendicular plate of the ethmoid bone. We will see these little things sticking out on the sides, and so you'd think the one on the top and one on the bottom, that would be superior, inferior, but that's not the case. Superior is a little higher where you can't see. This is the middle and the inferior nasal concha. So again, the middle and the inferior nasal concha, the superior would be a little bit higher to where you really can't see it. So we now just covered everything inside the nose. We covered around the eye as far as these holes. Let's talk about the eye itself. That's called an orbit. There's 3 bones really on the outside and 3 bones on the inside of the orbited eye. There's actually 4 on the inside, but 1 we don't tag because it's a little dot. But on the bottom, about where my thumbs are, this is the zygomatic bone, right? So that forms the lateral and inferior lateral aspects of the outside of the orbited eye. And then we can see the zygomatic bone forms the bottom and medial aspects of the orbited eye. And then we see the frontal bone going across the top. So we got the frontal, the zygomatic, and the maxillary bone that's basically making the outside of the circle. If you go slightly in, just slightly in from the zygomatic, you can see a little crack. This is called the lacrimal bone, and we call it that because, well, tears will go across the eye and then drain down in the nose with the nasolacrimal duct, and so lacrimal bone drains the tears down in the nose. That's why your nose runs when you cry. It's not just to make you more humble. When you look at the lacrimal bone, you can see a little crack here. If you go in a little more, this is the ethmoid bone, and remember the ethmoid bone, if you just like pinch it there, that's this bone in the inside again. We're pinching the sides of that ethmoid bone. If we go straight back on the sides, that is the bone called the sphenoid, and remember that's the one making the greater and lesser wings. Now the only one I didn't mention is the palatine, but it's about the size of the tip of this wood stick. I mean, it's just a very small little dot in there, so the chances of us picking on that are extremely low. If you were to take 2 sticks, could you grab me another? I think I dropped a bunch of them there. And stick them in. There you go. And I'm slouching as low as I can so everybody can see. So in case it looks like I'm laying here under the table, I'm sorry. But what I'm doing is there's a little hole in here. If you look inside, there's just a little hole like somebody drilled it out. But if you look here, they cross on the inside of the cranial cavity. And the reason that this is important to look at this is exactly how the optic nerves lie. They're going to come in and crisscross. Here in a couple of weeks, you'll recognize that as being the optic chiasma, where the nerves cross. So this would be the optic nerve going through a hole called the optic canal. And the reason again for that hole is for the optic nerve. For the posterior part of the eye, the little nerve comes off and goes to the optic canal. Does that make sense the way I'm explaining that? If you look in the eye, you'll see two cracks. And the word for like a crack or a ditch would be called a fissure. It's no longer a canal, which is a tube or a tunnel, but a fissure is a big crack. And there's one on top, which is the supraorbital fissure, and these you could see go into the cranial cavity. And then there's two more underneath called the infraorbital fissures, and it's the lower part, or the, oops, there we go. And these do not come out in the cranial cavity. They're kind of tight there, but they'll come out, you'll see coming out kind of underneath, and you'll see they're coming out under the cranial cavity. So the infraorbital fissure goes outside the cranial cavity. The superior or supraorbital fissure, I should have said, goes into the cranial cavity. When I say into, I just meant inside the hole here. All right, so I think we got the supraorbital fissure, infraorbital fissure. Pretty much got the whole eye there. Let's go down to the jaw and we take a look at this. And so the jaw is called the mandible. In the front, you can see two little holes, one here, and that's called the mental foramen. And so that nerve is basically innervating the teeth, innervating the jaw, innervating the lip and the gum area in this here. We call this the mental area, of course. I remember it because if this hurts so bad, it about makes you go crazy or mental, just as a side joke to help you remember it. When we look at this, we see that this mandible comes back and then there's an angle. So we do have a mandibular angle right here. It comes up and fits into the structure called the TMJ, which stands for temporal mandibular joint. And you can feel it on the side of your head. If you just put your finger there and open and close, you can feel it. So this is called the mandibular condyle, and the mandibular condyle fits right there up into the temporal bone. Here, sorry, I keep dropping this. Here you can see the mandibular angle. And so I just said that wrong. This is the angle. This is the notch. That's the mandibular notch. And then this here, where it sticks up, there's two things in the body that you have a similar name. One's going to be called a coronoid, and one's a coracoid. Well, I remember this one as the coronoid because if somebody talks too much, you get annoyed near their coronoid, and that helps me remember. Because when I want to accidentally call it a coracoid, I'm like, wait a minute, that doesn't rhyme with annoyed. So annoyed, coronoid, not coid. And so you'll see coracoid processes later. So now that we got at this angle, you can definitely see the temporal bone. Let's start talking about that next. So we talked about the zygomatic coming back, forming the cheekbone, but then this is zygomatic, but then it meets up with right here, there's a little crack, but this now becomes temporal bone, and temporal bone comes back, it goes underneath here, it comes up through here, and over on top of this squamous fissure, and down around the sphenoid bone. It's posterior to that. So again, this is sphenoid, this is zygomatic, parietal, and then occipital back here. So the temporal bone is kind of like that area, right about there. And so they say the most dangerous place to get hit in the head would be the temporal. And I had a buddy that got hit there with a baseball. You can see that it's very thin. You got a lot of brain in here that's sensory and motor tract right there. And it's kind of like if you got a crack all the way around it, that would be easily broken right through here. So that would be a big deal. Let's talk about the structures on that temporal bone. First of all, it's pretty obvious to see this arch here. So you could call it the zygomatic arch in the front. You could call it the temporal arch in the back. Some instructors are cool with zygomatic arch for the whole thing. But the real truth is right here is where they switch names. This is actually temporal arch, and this is zygomatic arch. You could also call it temporal process to the zygomatic bone. Zygomatic process to, there's different ways of saying it, but I just call it the zygomatic arch, but really back about from here back, it's temporal. So you do see this big gap here, and the reason there's a gap here is there's a muscle that connects from here and goes up under called the masseter muscle, and it helps you chew. And actually, if you take your jaw and kind of like clench your teeth, you'll feel this muscle kind of pop out, and that's the masseter. It fits right up under there. If you go back a little bit more, you guys see this hole right here? Well, on anybody, you glance at them, you see their ear. So that's the hole for the ear. And the name of that, don't put ear hole on the lab practical. You got to put external auditory canal or external acoustic meatus. And the true name that would be better is external acoustic meatus. Inside more, you would call it the canal. So external acoustic meatus is probably the best one here. You can see this definite process sticking down. And so when you put your thumb on the back of your head, right behind your ear, you feel this. And this is called the mastoid process. And that's very palpable in anybody. You just see that bump coming out, mastoid process. There's this little thing coming down here. It's called the styloid process. We'll probably look in this area and say, well, let's just tag something here. So either you got the styloid, the mastoid, the external acoustic meatus, or down here, the occipital condyle. And so the occipital condyles sit on C1. So basically the skull rests right on C1, right on my fingers there. It rests like that. You can shake your head yes, right on where C1 and those meet. And so the atlas is C1 hanging right under there, sitting right under there. Probably the best way of saying a skull is sitting on top of that. There's an obvious big hole here. You can put your thumb through it. It's so huge. Your spinal cord is coming down from the medulla oblongata and then turning into a spinal cord, and it comes through this enormous hole called the foramen magnum. Foramen magnum. And why magnum? Well, it's huge, right? You could go bowling with that. It's so big. This again is the occipital bone coming down that you have the foramen magnum and occipital condyles on. This is temporal that has the styloid and mastoid process and the external acoustic meatus. So we're done with the temporal. Unless you look on the inside, you can see that there's these big bumps, and you're wondering what the heck is in there? Why is it so thick here? And that's because if we took a hammer and chiseled this out, we'd actually see the malleus, incus, and stapes, and the inner ear, middle and inner ear in this area. So this is our for our balance, our hearing, and when we go through ear models up there, you'll see more of that. But that's all within there. There's a little hole here. We don't tag it anymore, but that's the internal acoustic meatus where the vestibulocochlear nerve allows hearing and balance. So now let's look inside. There's some holes you need to know. There's a great big hole in the bottom, and it's huge. So I like to think room to juggle for the jugular vein that's going through there. So it's the jugular foramen. And the carotid artery, which gives blood to the brain, is more tight. And I like to think crowded, carotid, room to juggle. So this is the jugular foramen and the carotid canal. Why is this called foramen and this is called canal? The foramens are more shallow. It's just a hole. The canal is more like a tube. And so if you flip this over, you need to see where those are coming out on the bottom also. So when you put those in there, you need to see that they're very close to one another. So the blood coming in to the head and the blood leaving are just side by side. But when you go on the inside, you see it's quite a bit different. That they're on each side here of the whole apparatus that holds the hearing and vestibular apparatus. So these two, very important because this is blood flow to and from the brain. Again, carotid artery, jugular vein, carotid canal is the name of the hole, jugular foramen, room to juggle, crowded carotid. All right, let's move forward. We're still looking at the holes here, but we're going to move our way up to the sphenoid. There's a hole that just goes straight in. You may or may not need to know this depending on who the instructor is, but that's the foramen lacerum. There's 3 in a row here. And I like to think review of skull from front to back. So review would be an R, which is foramen rotundum. Sorry, it fell out. Foramen rotundum. The next one is an oval, foramen ovale. And the next one in a row is the one I remember for skull, foramen spinosum. So I've got the rotundum, ovale, and spinosum in a row, review of skull from front to the back. And so I got those 3. And so basically those holes are now covered. If you remembered looking up a little, we had these 2 sticks going in here. Remember those were the optic canals. And so that basically covers every hole in the skull. I want to look at the center of the sphenoid here, and you can see the structure. To me, it looks like a Western horse saddle. So if I ever get me a horsey, I'm naming her Sella, because this is the Sella Turcica. And so that Sella Turcica just reminds me of a Western horse saddle, and therefore this female horse just helps me remember. There's a little dip inside the Sella Turcica, just like a Western horse saddle would be. But there's a gland called the hypophyseal gland. Now you guys probably know it as the pituitary, but it fits right inside there. That's the most protected thing in the skull, is right inside that groove. And the pituitary, which puts out 8 hormones, sits in there. But again, that's called the hypophyseal gland. And this is the hypophyseal fossa of the Sella Turcica. Hypophyseal fossa of the Sella Turcica. Flip it over. There's only one more thing I can think of. I'm going to pull this off just for a second so we can see. If you look, we talked about the vomer going up. There's a little crack here, and that's the palatine bone. That forms the hard palate inside the roof of your mouth. It's the posterior aspect right before the soft palate. And this here is part of the maxilla, so that's the maxillary bone up in here. Honestly, I think we just covered every single thing that we could possibly tag on this test, or basically the complete overview of the skull.